Hi, everyone. Welcome to the Uplifters podcast. Today, we have a very special guest, John Wendling. He's the CEO, Chief Executive Officer of Parkland Community Health Plan. And he's really an inspiring individual and a leader in the community. And so let me give you a little bit of insight who John is. John is a healthcare executive with more than 30 years of experience with the managed care and provider discipline. This leadership has given him direct accountability for establishing the vision and strategic direction for organizations, leading cultural transformation and organizational redesign. John has collaborated and worked with several governors' offices across 4 markets, including policymakers, legislators, House and Senate, philanthropists, and business leaders to transform the healthcare delivery system. John, thank you so much for joining us and welcome to the show.
Adam, thank you very much. Looking forward to it.
So, John, let's start with a broad question and let our audience get an insight of who you are as an individual and as a leader. So tell us about your journey from the beginning to where you are today.
Oh my goodness. I don't know if we have enough time for that, Adam. One of the things I often refer to is, how do you get to this seat? Well, usually comes with tenure. You have to have enough years. So no, actually, I had a very humble beginning. I started in the United States Air Force as a surgical technician, scrubbing my hands 5 minutes and passing instruments to surgeons. I then transferred that to back home to Cincinnati, Ohio, where I was in a similar role with Cincinnati Children's Hospital. During my time with Children's, they paid 100% of my undergrad. From there, I had the opportunity to move on to a healthcare delivery system, 32 acute care hospitals across 5 states and 10 different markets. I came into that organization as part of a leadership team, managing about 650 physicians in the late 90s, early 2000s, in an employed physician relationship with the system. Early 2000, like most hospital systems across the country, we divested of those employed physicians back out into the market and started working with our hospitals all around improved outcomes. And so did a lot of work either with physicians or with the hospitals to look at how do you improve the outcomes of the patient, ensuring a good consumer or patient experience, and controlling cost. We often think of controlling cost by cutting services, and actually, we were looking at it from the perspective of how do you reconfigure your provider agreements with the managed care organizations to take accountability to have improved care, but in return having a higher return. The more that we can address on the front end for the healthcare needs of an individual, it mitigates the risk on the back end for some catastrophic or higher acuity care down the road. And then I changed gears in 2006, worked for a medical director with that large integrated healthcare delivery system who moved over to the managed care side. And so I dipped my toe in the insurance arena for the first time in 2006. I came in as overseeing all the provider relationships by virtue of the individual leading the operations for the health plan in Ohio. I left that position and I ended up falling into that role. I got to tell you, Adam, talk about learning by the seat of your pants. I learned the infrastructure of a health plan. I felt like I was in a track meet, but it was great. It was a great introduction. It was a great learning for me, and that led to a provider-led entity in Ohio wanted to become a managed care organization, and doing a startup with them. To going to a publicly traded, and of all places, Lincoln, Nebraska, to do a financial turnaround. And that ultimately led me to Parkland here in Dallas, Texas. This is, what I've found over my years is I've become a change agent, looking at things a little bit differently to either to build them from scratch or to redesign to ensure viability and sustainability for the long term.
Yeah, I want to talk to you a little bit about that, because change makers and trailblazers and people that are uplift, there's a certain quality and certain things that they bring into the equation that people would want to follow them and listen to them and really take on their lead, because there's a lot of trust there. So tell me about maybe some of the lessons that had been with you since maybe earlier in your life and your career, and that helped you really understand how to lead organizations like this and how to make changes. And then maybe what are some of the obstacles that one need to look at, avoid, overcome as you trying to lead people, right, individual and an organization into a common vision and a common goal.
Right. So, as I was building out my leadership team here, this was a unique opportunity, and there's a couple of things that I've learned over the years. Is be comfortable in your own skin. Do not be spooked by the unknown. And it's not just a matter of putting your hands in the dirt and getting your hands dirty, especially during a turnaround, but you have to put your hands in the right section of the dirt, so that you can then effectively go through this process. It's about effectively communicating with whatever parties you're dealing with, whether it be frontline staff, peers, a governance structure. And I'm going to share a little story with you about what I walked into here. Here's the other thing, and my grandma Wisher taught me this. Patience, John, is a virtue, right? Don't get too far out ahead of yourselves. It's a crawl before you can walk, before you can run. And so, for myself, if I could do a little promotion of my parent organization, Parkland Health and Hospital System has been serving the Dallas community since 1894. Actually treated its first patient on May 19th of 1894. Yeah, a little history. I hold on to dates at times, Adam. Yeah. But anyway, it was the treating hospital for JFK in 1963 when he was assassinated. Today, Parkland Hospital is one of the busiest burns and trauma centers in the U.S. The hospital delivers 2 kindergarten classes every day of the year. 365 days a year, they're delivering 2 classes. So just under 14,000 babies a year, which makes it one of the busiest OBs in the U.S. They incorporated Parkland Community Health Plan in 1997 in front of the state going to a full risk managed care model for the Medicaid population. I walked into an organization in 2019, about $750 million in operating revenue, nearly 200,000 member lives that we were serving. And who greeted me here at the door when I came in was 15 FTEs. So we had 15 people running a organization of this size. The only way you do that is you outsource everything that you do. It defines you as a managed care organization. And so that journey began on that day. So this is where we get into this crawl, walk, run, and knowing where to put your hands in the dirt. I'm often in awe of the artist, and it's that paintbrush onto the canvas. And where do you place that first stroke? What is that first color hue that you're using on that canvas? And this is where you've got to be comfortable. You've got to be comfortable in your own skin. You can't be spooked by the unknown. And so, the journey began, like I said, January of 2019. It's been amazing, to kind of go through this cultural and business operating model transformation. We went in March of 2020, we went into a virtual environment. And at that point, there had been some attrition along the way, but we were at 18 FTEs. I had built about 50% of my executive team, but we were at 18 FTEs. we kicked off a $150 million investment in a core system to bring those services in-house as we were going into this virtual environment. By the end of the year, we had scaled to 77 FTEs. And as we sit today, we're at 140. We're still in a virtual environment. So we have many times over increased our staffing as we were building. And my COO does not necessarily like this phrase, but I'm going to use it. People, process, technology. And so these are the elements that were needed to be able to successfully transition away from our third party so that we could manage that business. It's the key drivers for decision making are what are the factors you need to consider to ensure viability and sustainability for the long term. And when you look at the operating model the way it was, definitely an opportunity for change. And I don't know if I exactly answered your question. I know I rambled on for a few minutes here, but
you did.
It's been an exciting journey. And I guess some of the biggest lessons learned is patience, going through the steps, going through the process, having directionally a vision of where you want to go with the organization. So I got to tell you, I've never had more fun in my life.
Yeah. What's interesting and inspiring in hearing you share is that the quality of a leader is when they face an obstacle or a challenge. I mean, this was during the pandemic, right? A lot of people were laying people off, and we know what the environment is like. And so, and you have innovated and really brought people and gave them opportunities, and you're creating an infrastructure and improving an infrastructure that is just, inspiring and is taking care of people and really doing some wonderful things. So what is that dichotomy between taking an obstacle or a challenge in your mind and really creating opportunities both for the organization and for others and for patients?
So here's, to me, this is the secret ingredient. And probably one of my greatest learnings as I went throughout my career. What makes an effective leader is being around effective leaders. And so I have to tell you, Adam, the executive team that I am surrounded with are some of the most dynamic individuals that come together. Listen, you got to understand, I talked about the COO previously. He was actually with me during a financial turnaround for a publicly traded. So one thing to know about a New Yorker, though, they speak their mind, right?
Yes.
And so what we have is we have an entire executive team that all have their own backgrounds and experiences and come with different components and different ingredients. It's amazing because we don't always agree, but we always come up with the best solution, the best answers to whatever it is we're trying to solve, whatever business equation we're trying to perfect. And so it's surrounding yourself with great people. And, I have often said that, when you look, so I hate pyramids, right? I hate because it looks like they're at the peak is, that's the end all, the be all. I tell you what, Adam, I slept much better when I was down lower on that pyramid. But in all seriousness, it typically is a sign of experience in backgrounds. But it's not about John Wendling. It's not about any individual member of ELT. It's about all of us. And I mean, when I say all of us, I don't mean all of the executive leadership team. I mean the entire organization. You kind of look at where we've come from to where we are today, but we've just begun, Adam. This is the front end. We needed to have this baseline, this base, in order to accomplish what we need to accomplish. And so when I look throughout the entire organization, executive assistants, analysts, managers, directors, it is, if we're going to accomplish what we are setting out to accomplish over the next 7 to 8 years, it's going to take the entire engine, and it's all, every component of that. So it's, you know, it's exciting to get us from January of 2019 to where we are today.
Yeah.
But like I said, man, we've just begun. We've got so much to accomplish. Anyway.
Yeah, that's almost 10x growth. That's pretty incredible.
So you ready for this?
Yes.
So here we go. So here was my commitment coming into the executive team for the health system, as well as the board. Number one, ensure sustainability, viability for the long term. The other commitment, though, was to serve as much of the community as possible. You know, we look at our parent organization, who's been serving this community since 1894. We want to follow in their footsteps. We also know that our parent organization is a thought leader. I mean, they're well respected across, you know, not just Texas, but across the country. And we want to do the same. Parkland Health and Hospital System is not the largest in the country, but it is one of the most respected.
Yeah.
And so you don't have to be the biggest to be the best.
Yeah.
And so we want to be that thought leader. We want to be the one that, listen, I have never been in the game for following anyone. We want to lead. And so, but you have to, another thing that my grandma Wisher always used to say is the proof is in the pudding. It's not what you say, it's what you do, right? And so I've got to throw in my grandma Wisher twice here. So
yeah.
But anyway, seriously.
Yeah.
And so it's about serving more of the community as we move forward. And so as we look out over the course of the next 4 years, there are additional Medicaid populations that we would like to serve that we do not serve today. There is the marketplace through the Accountable Care Act, where you have a population that is uninsured, that do not qualify for Medicaid benefits, not necessarily unemployed, just where they fall in within that poverty level. So we will be offering 2 plans through the marketplace, so we can get more of the community insured. You look at our parent organization, 12,000 employees, 20,000 total dependents on a very well-respected national healthcare or health insurance carrier. I'll leave it at that. But we should be the carrier for our own enterprise. And so as you look out over the next, at this point, over the next 4 to 5 years, we're going to take this $750 million organization and we'll be somewhere in the neighborhood of 1.4 to 1.5 billion in operating revenue. And as we move out to 2028, 2029, we should eclipse $2 billion in operating revenue. The legacy of that is not about achieving revenue projections of 1.4 to 1.5 to 2 billion. Legacy will be sustainability, serving more of the community, and being the thought leader, either locally at the state level or at the national level, like Parkland Health and Hospital System. Yeah. So we've got a great mentor with the health system, and we just want to make them proud. Yeah. So.
Yeah, I know your mission is to change the face of healthcare access, both locally and beyond, right? Mm-hmm. So how do you see positioning your company as the plan of choice for your client, your customers and patients?
So and that's part of the journey. And so it's how you demonstrate in what you do, in the delivery of service that you provide. And so you're absolutely right. I mean, we want to be the plan of choice for the community, whether that be our current members or future members, our providers, other key stakeholders. And it would depend on what population you're serving. So for a Medicaid population, it could be the food banks, the YMCA, the housing authority. And then obviously at a state level, whether it be your trade associations. I've had, and not just me, members of my team as well, has had a handful of conversations with legislators over the last, actually during the entire session, and answering questions and, providing feedback on any bills they may be introducing, but also with, Health and Human Service Commission for Texas. That's who our contract is with, the Texas Department of Insurance, CMS at a national level for Medicare. It's demonstrating value, demonstrating worth, and it's taking advantage of opportunities when they present themselves. And I'll give you one example. There are several, and we're building these foundational blocks as we move forward. As we were going into this pandemic last year, a couple things were very apparent in March of 2020. Very few of our agreements were in some kind of alternative payment model, value-based reimbursement. So that's where you come work through an agreement with a provider, between the provider and the managed care organization, to say, if you provide exceptional quality healthcare, then we'll reimburse you X plus Y. So we didn't have a lot of those in place at the time. The other thing we know at a state level, and you could also take this out to a national level, less than 10% of the provider practices across the state of Texas had some kind of telehealth, telemedicine platform solution. As we headed into April, our provider agreements were at that point pretty much the same. It was interesting, the telehealth solution had jumped from 8.9% to 88.7% almost overnight. So, kind of talk about our scaling from, people, process, and technology. Yeah. You take practices across the state of Texas with less than 10% with some kind of alternative solution to almost 90% was amazing. But one of the things, getting back to the thought leader, what was happening is you were seeing decreased utilization. People did not want to leave their homes. They were not going to their physician practices. Obviously, the concerns with that, especially with a chronic individual, as a chronic condition that needs daily, weekly maintenance, that can really turn into a catastrophic experience down the road. And so we engaged with 3 of our largest physician practices in the Dallas market and came up with these APMs, these alternative payment models, which did a couple things. It has more engagement from the providers to our members, to their patients, to seek care, either through coming in the office or through maybe a telehealth solution. But what and the way we set these up was savings, shared savings. We would split the pot, and so we went from where we were in value-based to significantly increasing the number of the percentage of our healthcare spent in some kind of value-based arrangement. I can tell you that by the end of 2020, for just these 3 practices, we paid out nearly $1.7 million, where they were able to effectively drive more care being delivered within the practice, as opposed to maybe unurgent, non-emergent ER visits, and improved and increased access to care, higher percentage of children being immunized, and so share the wealth. And so that's those are a couple. So those are the type of things that will help drive. I think I just rambled a long time, and I apologize.
No,
but it's I like to talk. So, but no, seriously, these are the kind of things where you have collaboration between both parties. We want that. We're experiencing the same thing with one of the 2 health plan trade associations in the state, where they are leveraging our leadership more as they come up with solutions, looking to testify on behalf of the association on certain bills. And so it's Uh, I'd like to say we could get there tomorrow. We will get there. That's not a doubt. It's working through and having patience to get there.
Yeah. This is, your commitment to adding value is definitely apparent, and it's really inspiring. Tell me a little bit about the people that inspired you in your life. You mentioned your grandma a couple of times,
Yes.
and maybe other people as well, both either in a family or business
Right.
leaders that you learned from or inspired you,
Right.
and you learned lessons that are with you now in life and in business.
Right. Right. No, absolutely. So obviously my grandma was here, and there were many great qualities of her. To her, she was an individual who was very kind, but also she was able to see things that I think sometimes we miss, and was a we grew up in a large family, very loving, but she was able to cut through. Sometimes it gets kind of crowded, at holidays.
Yeah.
She was able to cut through that and make sure that everybody felt good. It was a good experience. One of the other influencers in my life was Coach Downs, and one of my greatest learnings from this individual was taking accountability as the leader, as a teacher, as a coach, as a supervisor. One of the things he always said to me was, do not worry about the wins and losses. Focus on execution. Focus on key deliverables, whatever that is. And I'm ad-libbing here a little bit because I didn't hear the same things when I was 11 years old.
Sure.
But wins and losses will take care of themselves. If you work on your game, if you work on your skill, wins and losses will take care of themselves. Take accountability for, and he was saying this about himself, take accountability for opportunities for improvement and share the wealth of their successes. I was the oldest of five. I'm adopted, the oldest of five. I always had to make sure that Danny didn't fall in the lake when it froze over when we were playing hockey, or make sure you hold Kate's hand when she was riding the bus. I took that advice as I was maturing, and ultimately for the organization, I have a fiduciary responsibility, but the successes are not about me. I have the fun job. I get to do things like this.
Yeah.
Surround yourself with good people and let them run their portions of the organization. Yeah. A couple other great leaders, and I won't get into too much detail with either one of them, but Dr. Curtis Sheldon and Dr. Don Casey. Dr. Curtis Sheldon was the first individual that saw something in me that I didn't even see it myself at the time. And it was the first opportunity to be a change agent. It was while I was with Cincinnati Children's, and looking at creating efficiencies on departmental budgetary items. And he had identified at a high level a lot of inefficiencies, and he gave me the authority and the autonomy to drill into it, work with the nurses, work with the physicians on changing practice patterns, and I still stay in contact with him. After this was, oh my goodness, Adam, this is dating back to the late 80s, early 90s. I was so much younger then, but he was he not that I didn't have it walking in the door. He gave me a different level in a different lane of self-confidence. and really opened some doors for me as I kind of progressed throughout my career. The other one, and I'll keep this very brief, is Dr. Don Casey. And I worked with him at Catholic Healthcare Partners, this 32 acute care hospital healthcare delivery system. One of the famous phrases that he always used, and it taught me about another element of relationships. Dr. Casey always talked about 7 equals 7. Okay, sure, 7 equals 7. But what does that really mean? And what he was talking about is ensuring that, you know, in any redesign of a program, any redesign of an agreement with the provider and the managed care organization on an, you know, alternative payment model, that, you know, we have different systems. We interpret the input of data, the, you know, numbers that they come out to be data, which turns into information. And so he always made the argument that, you know, we could both measure mortality, but we could come up with different numbers with the same inputs.
Yeah.
So he always talked about 7 equals 7, and my leadership team hears it more than they want to hear it. But it's about understanding the other party, and it's about appreciating, you know, appreciating and understanding both entities and how you come together to come up with a consensus on what 7, how we get 7 equals 7.
Yeah,
so
that's wonderful. Thank you for sharing. So we're coming in to the end of our show. And so one of the questions that I ask often is, what is the legacy that you want to leave behind? What are you committed to? And how do you want to inspire and empower other people?
Yeah, that's a great question. In fact, I love this question. So I coached all my kids competitively, from Pee Wee football to knothole and Babe Ruth, Little League baseball, to even competitive AAU basketball. Here's legacy. It's not about the wins. It's not about the tournaments and the championships you won. I have a whole storage unit down on Harry Hines in Dallas with dust collectors, these huge, you know, Florida, you know, halfway, you know, 3-4 foot trophies. The trophies aren't important. Here's legacy. There are 5 young men who, 3 of those I started coaching at the age of 4, that are now coaching young kids. And, you know, when they come back and say, Coach John, there's so much you taught me. This is why it inspired me to coach. That's the legacy. The trophies, the wins, listen, those feel good, and they're a type of reward. But legacy is the next generation. And so this is the legacy that I'm currently in. First of all, there have been 4 individuals that have come from across the country to join me in this journey. So, you know, that's, to me, that's rewarding. That's rewarding when people are willing to relocate to join you in a cause. To me, that's extremely important. But the legacy part of that will not be that we achieve 1.4 to 1.5 billion as we head towards $2 billion. Operating revenue doesn't mean anything if you're not profitable. It just means more dollars that you can lose. Yeah. Legacy will be sustainability, viability for the long term, well beyond what I am when I'm here. Legacy is also, and I look at there, you know, right now I see 4 to 5 individuals at various stages of their career that will assume the seat if they choose. I know I say 4 to 5 because 4 or 5 said they would like the seat. I keep trying to tell them, Adam, you're not going to sleep as well. But that, you know, to me, that is legacy. It's the next generation. The other ones are nice accomplishments. They're nice pats on the back. But, you know, it's all about setting up for success for the next generation. So.
Wonderful. Thank you. So inspiring. So we usually give at the end of the show 60 seconds just to let people know how they can support you and your efforts, and Parkland Community Health Plan, and whatever causes that you want to bring some light to, and any open mic. That's, this
Mike,
is
I
your
love it.
time. Yes.
I love it. So, as part of this evolution for Parkland Community Health Plan, we are getting more engaged in the social community. So I would encourage going out to our social pages. There's a lot of nice information on, addressing certain healthcare conditions. The other thing I'd like to spend just a few seconds on is we have, with the current population we serve, we have a lot of opportunities that we can support our community. For example, in zip codes that end in 215, 216, and 217, these are food deserts in Dallas, which means within a 3.5 to 4 mile radius, there is no fresh produce, meats, dairy available. What you typically find is a higher propensity of having fast food, more liquor stores, more instant lottos. We have a higher percentage of individuals that suffer from obesity, diabetes because of this. And so, there are programs such as Bottom Farms, which actually has a farm in one of those 3 zip codes where they produce their own dairy. They raise their own cattle. They have stores where they sell a lot of their products, and getting more people engaged in the workforce. Adam, I'm going to tell you, there is so much we could talk about here, maybe for another setting. Yeah. But there are so many opportunities where we can support, and whether it be food deserts, digital deserts. I mean, and the list goes on and on.
Wow, thank you.
Yep.
John, thank you so much for uplifting all of us and sharing your journey and insights and golden nuggets and really inspiration. And we really appreciate it. We hope you come and join us again in another time. And we look forward to getting to know you more and Parkland and supporting your cause. Thank you so much.
Thank you. You have a great rest of your day.
Thank you. You too.